This is News Radio with 1300 and 1069 FM. You're listening to Talk of the Town. I am Steve Kelly, and with us today, Dr. Keith Javery, who is with the Javery Pain Institute. Doctor, thank you for taking the time today.
Thank you, Steve. Appreciate it.
We have, when it comes to chronic pain, a lot to talk about today. Might be a couple of Talk of the Towns. Generally, tell us a little bit about what you bring to market, who you help, and who is right to call and find out more information. Or let me give you the website up front too, javerypain.com. But what kind of pain are we talking about?
Steve, we're talking about any kind of pain. In fact, that's one of the most common questions we get. Well, do you treat headache pain? Do you treat spine pain? We treat pain literally from head to toe. Pain of head, spine, belly, back, you name it.
So chronic obviously is a word that means something, and we're not talking about something that lasts with you a day or two. How do I know when I need to get a specialist like you involved in my pain management?
That's a great question, and it's very appropriate because let's say I go out and I'm hiking, sprain my ankle. No, you don't need to see me. It is either you rest it, you see your doctor, your family doctor. That's where that should go. Chronic pain, I can give you the official definition, but bottom line is if it continues beyond 2 to 3 months, and some people say 2, some people say 3, after it should have gotten better on its own. So I sprained my ankle, that's gonna hurt me for around 2 weeks, 4 weeks, 6 weeks. So by 12, 14 weeks, if it's still bothering you, you should see someone like myself or an accredited pain center.
So talk to us a little bit. Again, we're talking to Dr. Keith Javery here on Talk of the Town. The website is javerypain.com. That's Javery. Tell us about the different kinds of chronic pain. That you mentioned from injury, maybe breaking your ankle. But we also have diseases and long-term illnesses that can contribute too.
Right. Most of the things we see are what I call the disease, quote, end quote, of aging. Now, aging itself, it can be defined as a disease, although it's not a disease like cancer, but it is where you're getting older, and by definition, that's a disease on the cellular level. So the most common indications where we see this is one, what we call nociceptive pain, pain of everything except from or of nerves, bones, joints, arthritis, thinning discs, worn out discs, bone spurs. And then there is pain of and or from nerves, sciatica, spinal stenosis. Every time I stand up or walk too long, I get a horrible backache, and it sometimes shoots down my legs, sometimes it doesn't, or my neck, or I have headache and mid-back pain. I don't know why. I've been to my chiropractor, I've been to my family doctor. Medicines help maybe a little bit, maybe not at all, or medicines help, but the minute I stop taking it, my pain becomes severe. So anything that, and here's the big thing I tell my patients, anything that either slows you down or prevents you from doing what you have to do or what you want to do on a consistent basis, that should be treated, because when that's not, patients will invariably will go down that spiral. They'll just go right, get worse and worse, and then it starts affecting everyone around them, like family, friends, job, everyone.
Dr. Javery, let's talk a little bit about an epidemic that we have right now, and that is an opioid crisis. So there are folks that think that they need to be medicated for their pain, that's the only route. And there again is kind of a circling drain because those things can be cumulative. The more you take, the more you need. Talk to us a little bit about what you offer that can keep people pain-free, or as pain-free as you can get. I mean, you have to manage expectations, right?
You hit it on the head, Steve. When I tell patients, there are patients where we can make them pain-free, where they say, I don't have any pain that I can tell. That's not the majority of the time, but pain reduction enough to where I am now fully functional. And as far as opiates or narcotics have a place. I mean, they're one of many things. I liken it to a stew. Mm-hmm. So in a stew, you don't just make a stew with water and beef cubes. I mean, you put in vegetables and seasonings and you simmer. You got a special recipe. Well, just like that, everyone's situation, even their pain problem. I can have a patient that has worn out discs and has back pain and referred hip and buttock pain every time they stand up because of degenerative disc disease. Well, maybe they do need some opiates, but their opiates now are constipating them. They may feel funny, they may fall. So perhaps the things we do, like very specific targeted, injections under mild sedation. Patients, most of them don't even remember getting this done. soothe those discs and those nerves to where, for typically even up to a few months at a time, patients will stand up, say, hey, I can only stand up 2 minutes, now I can stand up almost an hour without having pain. But yet they still have some pain. So we then will utilize sometimes very low dose opioids. Sometimes some of the newer medicines are what I call opioid analogs, which just means kind of like opiates or narcotics, but they don't have nearly the amount of addiction or the dangers like stopping breathing, which we all need to do, or some of the other side effects that are not, that can be serious but are troublesome, like constipation, sedation. So we try to find ways, interventions, physiotherapy, injections. We try to avoid surgery, but sometimes we have to. All of these techniques, as well as just talking to someone, what can you do, what can I do every day to feel better? So opioids, I liken it just to any other tool. If it's not everything is a nail, and so not everything needs a hammer. So some patients do need that, but our goal is to reduce that if you can, or if we can't, to manage it as appropriately and safely as possible.
JaveryPain.com. That's JaveryPain.com. We're talking to Dr. Keith Javery. Doc, a couple more questions in the time that we have. A lot of people don't come to you or don't go to the doctor in the first place because they're either underinsured or they're afraid that it's going to cost them an awful lot of money. Do you help navigate the whole healthcare process to make sure that they get your services and then they get it paid for or partially paid for?
I'll tell you, prior to a few years ago, that wasn't even necessary. The patient came in, they either had, if they didn't have insurance, they had Medicaid. If they had Medicaid, they had Medicare. And even patients that didn't have any insurance, we would have special rates for and payment plans, etc. But now, even the patients with the quote Cadillac plans, I mean the best plans, have problems. So yes, we do. In fact, I have several staff members that we navigate or help the patients navigate this maze of problems. Well, I don't understand. They said that they wouldn't cover this, or how do I get that covered? We'll work with the patient as well as their family doctors or referring doctors on getting that approved and seeing what is approved and what is approved, what we can do, and also explaining, listen, this isn't approved, so instead of A, we're going to do B. And so, yes, we navigate that, and I walk this path with the patient, and that's the key, because today it's very difficult.
Talk to us about outcome and about some of the things that you have seen. We've talked about pain and we've talked about healthcare and navigating all of that stuff. But as a doctor that got into the business to help people, talk to us about what you get to see at the end of this.
I'll tell you what, it's very rewarding. I mean, it can be frustrating, but for the most part, the vast majority of our patients, as in somewhere between 85 to 88%, will tell me within just the first couple to few treatments, geez, doc, oh my gosh, you're a lifesaver. I can now do this better. I couldn't even go from my bed to the bathroom. Now, that sounds kind of funny as a punchline to a joke, but it's very serious. There are patients that literally can't do that. And so when the patient comes back and tells me that, I mean, we both, smile about it, but I get a lot of hugs with it. And in some patients, it's, doc, I can't run the river run anymore. I can only manage 5K. And so they're both equally as important. And so it's very, very satisfying to me. There's tough spots too.
Sure.
We talked about the insurance issues and some of the things that the patients need. They don't do this, but I tell the patient, if you walk this with me, I'll walk it with you. And so it's very gratifying, but it can be frustrating because of external forces.
Part of my job as a host of the show is to describe to people what they can't see that I can. You're a pretty serious guy. We've been talking for about a half an hour now, but when we talked about outcomes, you had a big smile on your face, and I think that's great. If you would like to find out more information, can I make an appointment via the website as well?
Well, what we do is you check with the website, you call up, and you'll be directed straight to what we call our referral coordinator, and she will answer the phone. And if you have a family doctor, we'll work with your family doctor to get you in. If you don't, or you just want to come in to see me, we'll take that as well. And she will, again, just walk you through it. And it's just 588 pain. And those are the days when I know we had the numbers on the digits. But
right. It still works.
Yeah, it's just, javerypain.com. It's got the number on there. And if they call us, we'll walk them through it.
That is Dr. Keith Javery of the Javery Pain Institute. It has been a pleasure. Thank you.
Thank you, Steve.
This is Talk of the Town on News Radio with 1300 and 106.9 FM.